Hello everyone, this is Asha from RN Center. RN Center is a well-established training institute exclusively for nurses and healthcare professionals who are seeking opportunities globally. RN management shows keen interest in supporting its students in training and guiding them in placement activities. RN management provide coaching for the various exams like HAAD, DHA, Prometric, NCLEX-RN and PN as well. And we have 100% pass percentage for the crash courses exclusively. Now let us discuss about the frequently asked topic in DHA, HAAD and Prometric. The most frequently and important topic asked in these exams is meningitis. Okay, today let's start about the presentation topic, meningitis. Meningitis is the inflammation of the meninges that cover the brain and the spinal cord. Meninges is the Greek term which means membranes. Membranes surround the brain and spinal cord, which forms a protective layer which surrounds the brain. As I told you, meninges means membranes. It consists of Dura Mater, Arachnoid Mater and Pia Mater. Now let's see in detail about the layers. Dura Mater. This is a thick and tough layer, adheres to the skull on one side and arachnoid matter on the other side. It provides an extra protective layer for the brain and spinal cord and also provides a system of venous drainage where blood can leave the brain. And the second layer is the arachnoid matter. It is present between the dura and the pia mater. It has the consistency and appearance of cobweb. Strands of connective tissue called arachnoid trabeculi stretch between arachnoid and pia mater. They help to suspend the brain in place. Subarachnoid space is the other area which is present in between the arachnoid and the pia mater, which is filled with cerebrospinal fluid. The third and the innermost layer is the pia mater. It is a thin layer. It forms a tight membrane around the brain and spinal cord, acting as an additional barrier and aiding in the secretion of cerebrospinal fluid. And now let's discuss about the causes of meningitis. The common causes of meningitis can be infectious and non-infectious agents. The infectious agents can be bacterial, viral, fungal and TB. And non-infectious agents are NSAIDs, brain surgery, head injury, systemic lupus erythematosus and cancers. The causes of bacterial meningitis can vary according to the age group. According to age group, organisms fall under 4 groups, that is 0 to 6 months, 6 months to 6 years, 6 years to 60 years and more than 60 years, that is elderly. For easy to remember, the organisms are categorized as short forms and are displayed in the table as read. So please viewers, pause it and go through them. So now let's discuss about the signs and symptoms of meningitis. The common signs and symptoms of meningitis can spread through direct contact like coughing, sneezing and kissing. The other signs and symptoms are fever, headache, nuchal rigidity, that is stiffening of the neck, photophobia, abnormal sleepiness, confusion and vomiting. And the signs and symptoms may vary in infants. They have the common symptoms like lethargy, poor feeding, crying and vomiting. Next, positive signs of meningitis. The common positive signs of meningitis are Kernig's sign and Brudzinski's sign. These signs are commonly assessed by performing the tests like if we see about Kernig's sign. Kernig's sign. Kernig's sign is essentially a way to demonstrate that the neck is not simply stiff but is irritated. With the patient lying flat, the examiner flexes a hip 90 degrees and then attempts to extend the lower leg at the knee. Pain on extension is a positive sign. Next test is Brudzinski's sign. To test for this sign, the patient lies on his or her back and the examiner puts one hand behind the patient's head and the other on the chest. Using the hand behind the neck to raise the head but pressing on the chest with the other hand, if the hips and the knees flex, the neck sign is positive. And the other tests for meningitis are blood tests, chest X-ray, CT scan, MRI, LP, lumbar puncture. Lumbar puncture. If there is increased ICP in children, first we will go for the CT scan and then do the lumbar puncture. The treatment of meningitis varies according to the type of the organism. If you see the treatment, depending on the type of the organism, it's being different. First, Streptococcus pneumoniae. The recommended therapy for Streptococcus pneumoniae can be penicillin or ampicillin. Or we can go for vancomycin plus third-gen cephalosporins. And the duration of treatment could be for 2 weeks. And the other organism is Neisseria meningitis. The recommended therapy for Neisseria meningitis is again penicillin G and third-gen cephalosporins. The duration of treatment is for 7 days. Haemophilus influenza. The recommended therapy for Haemophilus influenza is third-gen cephalosporins like ceftriaxone and cefaxime, and the duration of treatment is 7 days. The other organism is E. coli. The treatment of choice for E. coli is same as Haemophilus influenza. It includes the third-gen cephalosporins like ceftriaxone and cefaxime, and the duration of treatment is for 2 weeks. Listeria, the other organism. The treatment of choice is ampicillin or penicillin G, and the duration of treatment is 3 weeks. Group B streptococci. The recommended therapy is same again, ampicillin and penicillin G, and the duration of treatment is 14 to 21 days. Now let's see about the complications of meningitis. The common complications of meningitis are brain damage, seizures, abscesses, myocarditis, shock, hydrocephalus, sepsis, deafness, organ failure. The common organ failure is kidney failure, and it may end up with death. Now let's see about the vaccines. Vaccines can prevent many of the organisms that cause meningitis. Many of these shots are given for the young children to prevent meningitis. And please go through the immunization schedule which is displayed in the table. And the other vaccines which are commonly given for young children against meningitis are MMR. This is a vaccine given against mumps, measles and rubella. The children who are potential to develop mumps, measles and rubella also have the potential to develop meningitis. And the other vaccine is varicella vaccine, and it is also called as chickenpox or shingles vaccine. Now let's see about chemo prophylaxis. The treatment of choice for chemo prophylaxis is rifampicin. Rifampicin is the medication usually given to the family members of the affected person, but rifampicin is contraindicated for the pregnant woman because it may cause harm to the fetus. Instead, for the pregnant woman, you can give a single dose of azithromycin or ceftriaxone. These are the treatment of choice for pregnant women, because rifampicin is contraindicated in pregnancy. Thank you for watching our video. Please do subscribe for further videos.